I think the issue of mothers getting conflicting information, especially when they're providing milk or pumping or breastfeeding their babies that are in the NICU, is really very, very common. If you look at the studies, that's one of the reasons many mothers really just give up. And the time that tends to be the most conflicting is right after their babies are born, with how frequently they must pump, what type of pump to use, the procedures for pumping. And the other major time is when it's time for the baby to actually feed at the breast. Those are the two times when mothers say that the nurse says one thing and the other nurse says something else, but then the doctor says something else. So the fact that you're seeing that is not that uncommon. And that's actually one of the reasons that I developed the scripted talking points that I did for our own hospital. Because today in my lecture, I spoke about the ones for breastfeeding in the NICU. There is also a set of talking points for discussing donor milk with mothers in the NICU, and that priority is to distinguish the fact it's not your own milk. But we also developed a set for talking about the importance of exclusive breastfeeding in the maternity hospital stay. Because what we found again was if the nurse or the doctor didn't have the answer, they would give a personal anecdote or their personal experience, which many times was a bad one. You know, it was based on what the wife had done or what their bad experience with breastfeeding. So that was our focus, is really take this evidence that we've acquired from our own research as well as others and put it into this format of this is what the mother asks, this is the right answer, and then the third column being the citations for what that evidence is. Evidence really is no good to anyone if it is not practiced, if it's not implemented. And one of the issues, especially for us in newborn intensive care, when I first came and started our program at Rush in 1996, I really wanted it to be completely evidence-based. And I started with the neonatologists. And I focused on studies. That's what this study shows, this study shows, this study shows. And then little by little, they would say to me, I just spoke with this mother and she's in antepartum at 26 weeks. And I told her that if your baby is born today, we can't stop the labor. I need your milk because your milk is going to reduce the chances your baby can get a serious infection and that your baby gets a serious bowel disease. And went on through that whole list of things. This is what our physicians outline for the mothers. That's very different for a mother of a 26-week baby than hearing your milk is better than formula for your baby, because she can't apply that to her situation and her baby. So that real individual, this is why it's important. And our studies found that that does not make mothers feel guilty or pressured or coerced. In fact, they look for this information. And I also use the analogy, we went through this years ago with smoking. We went through it with car seats. You know, we don't want to talk to the parents about car seats because that might make them feel guilty if they don't have one. Or we don't want to talk about smoking, it might make them feel guilty. So I think this is the same issue.